Okay, so let me introduce myself real quick, since you guys have been introducing yourself, and then let me introduce a little bit about what we're going to be doing today. So first off, my name is Jenny Haddle. I am a Senior Learning and Adaptive Management Advisor from Save the Children and working with IDEAL. I'll introduce that a bit more soon. And we are here to learn about promising practices from recent multi-year humanitarian activities. So if you're in the wrong place, that's okay. It'll be very interesting. Please stay. Before we start, very important, we would like to invite you all to select your preferred language. This event's available in English and French. So by clicking the interpretation globe located at the bottom of your Zoom window, you can choose English or French. So please go ahead and do that. The globe located at the bottom of your Zoom window, please select either English or French. So that ensures that you'll always receive the interpretation you need. All right, that taken care of. Let's move in a little bit to some of the introduction of IDEAL and why we're here today. I've already introduced myself, but I am excited to be able to welcome you to this session. It's the third session in a series that IDEAL is doing. As you can see on this slide, IDEAL is a learning activity that's funded by USAID's Bureau for Humanitarian Assistance. IDEAL aims to strengthen emergency and non-emergency food security activities by focusing on foundational skills such as adaptive management, data for decision-making, and HDP coherence that basically help to enable more effective programming. We also manage and host the Food Security and Nutrition Network website and newsletter. So you can learn a little bit more about IDEAL if you follow that link that Bella has posted in the chat. So this webinar series is HDP Coherence in Practice, Insights from the Implementing Community. So the first thing I want to highlight from that is the implementing community. IDEAL has really made it a priority, and I would say maybe its mission, to elevate stories, practices, and learning from implementing partners working directly with affected communities. We really feel that sharing practical experience, like what we'll be doing in this webinar, combined with technical understanding, is an effective way to continually adapt and design more effective food security programs. So that's one piece. The implementing community is really important, and we feel that it's especially important to raise up the stories and practices that are happening in the activities that are currently on the ground. The other piece here is HDP Coherence. So what is HDP Coherence and what does that really mean? In early 2022, USAID released Programming Considerations for Humanitarian Development Peace Coherence, a note for implementing partners. You can follow the link that has just been posted and actually access that document if you have not read it or you're not familiar with it. Please check it out. I think it's really helpful to ground what it is that we're talking about today. In that document, HDP coherence is defined as approaches that promote complementarity and collaboration across humanitarian development and peace actors, basically in pursuit of a common agenda to maximize impact and sustainability and reduce the need for humanitarian assistance over time. In other words, HDP coherence is really about getting out of our silos and working together to meet longer-term food security and resilience needs, while also addressing emergency needs caused by shocks, and or vice versa, really, working to build resilience after the occurrence of a major emergency or while navigating longer-term crisis and conflict situations, which I think really describes well the context of multi-year humanitarian activities, and we'll really be exploring those activities today. So while the concept of the nexus or HDP coherence isn't really new, today's unprecedented and compounded shocks and stresses in an, I guess, increasingly more complex and interdependent world really make it more urgent for us to move past our silos and embrace a more holistic and connected approach. So IDEAL has been exploring this concept with implementing partners over the last 3 years through various different kinds of learning events, such as an online knowledge sharing series in 2022 and an in-person regional knowledge sharing meeting in Kenya in 2023. I would say that learning from those events really inspired the publications that are being highlighted in this current webinar series. So if you're interested really in digging deeper into HDP coherence after today's webinar, I really recommend you explore the recordings from the knowledge sharing series and download the report from the regional knowledge sharing series by checking out the links that Bella has just posted in the chat. But I'd like to share one learning that I pulled from the knowledge sharing series in 2022 that I think is quite relevant for helping us consider the utility of multi-year humanitarian activities for improving HDP coherence, and really why the topic of today's webinar is timely. In fact, this learning comes from a discussion that featured one of today's featured activities, Complementary Action for Resilience Building, or CARB, from South Sudan. And that learning is longer-term humanitarian funding is appropriate in contexts in which regular environmental shocks are the norm and or prolonged conflict is a reality, such as contexts like South Sudan. So as expressed by that representative from CARB in this discussion, peace is a process, not a project. It's not one project, and building the relationships necessary to achieve peace and move people closer to self-reliance in general or after an emergency takes considerably more time than 3 to 6 months. So in a world where contexts such as these more complex situations are more prevalent, understanding promising practices from multi-year humanitarian activities and considering how to better implement them in the future is important. So with that, I would like to turn it over to my colleague Bjorn, who will take us deeper into the topic of today's event.
Thanks, Jenny. Thanks very much. I hope everyone can hear me okay. Just a kind reminder to myself, and if you can support me on this one, if I start talking too quickly, whether that's for the French interpretation or just in English, I tend to talk quite quickly when I'm nervous, and just please drop a message in the chat and tell me to slow down. I'll really appreciate it. And well, hopefully you'll get more out of this as well, if you can keep up with my quick pace of talking. All right, now that we've got that out of the way, we've got a pretty straightforward agenda today. We'll start by hearing a little bit about the study itself. We'll hear about how it came to be and the methodology, and then we'll dig right into the key findings. And in classic IDEAL fashion, we've got some colleagues here from the activities themselves that will join us to kind of give us some examples. I hope that today isn't just a kind of regurgitation of the findings in the report, but we can learn a little bit from the colleagues who implemented directly and kind of see this as something that builds upon the report itself. So we'll go through the key findings by phase. It's kind of a natural way to look at things. We start with the design phase, and then lessons learned from the implementation and wrap up. And then finally today we'll end by going through some cross-cutting themes that were common across all of the different activities that we looked at, and also across all of the phases themselves. And throughout, we want you to think of any questions that you might have. Go ahead and drop those into the question and answer function in Zoom. So that's on the bottom of your Zoom screen. But you can also just drop any questions that you may have into the chat, and we'll make sure that we have plenty of time to address those at the end of the session today. And we're going to get some things started off here with a quick poll. If we can go ahead and launch that, you can see it. It's just a quick question of, we want to know why you're here. So go ahead and say what prompted you to attend this event. I know what my option will be. And we'll just take a minute so everyone has a chance to respond. Okay, it's a one question poll. I think we've pretty much done it. It's great to see the responses here and some clarifications in the chat as well. I admit that I chose that I habitually attend events to get out of other tasks just because it was my favorite option. But 7% of us did. And the majority of us are implementing or interested in implementing. Thanks, Jen, for that as well. They're interested in implementing or have already implemented one of these activities, which is fantastic to see. Can we go to the next slide? That's exactly what we're here for today. This is the report. Bella's going to drop a link to the report itself in the chat in just a second. There it is. And the question we want to start with is, who is this report for? And it's exactly for the responses on the poll, the people who are here today, people who might implement the multi-year humanitarian activity, or people who already have and are considering doing it again. It's very focused. The report is entirely directed at implementing partners, implementing partner organizations, and it's focused on promising practices and lessons learned from the initial 5 BHA multi-year humanitarian activities. Where did this report come from? Well, this report came from an idea initially from BHA to look at their pilot activities. They wanted to capture, practical best practices or promising practices and practical guidance and lesson learned. Ideal was very interested in conducting the study. We kind of jumped on the opportunity because these multi-year humanitarian interventions are some of the best opportunities in the world today to conduct HDP coherent programming kind of across the nexus. So the idea came from our colleagues at BHA, and Ideal was happy to get involved. And there were a lot of people who got their hands in on this study and contributed a lot. We've got our colleagues at BHA to say thank you to, but also the implementing partners themselves who implemented this. If we can go to the next slide, please. So here are the 5 pilot multi-year humanitarian or emergency activities that were looked at in this study. We have Bakari, implemented by Mercy Corps and a wide variety of partners in Nepal. We have the CARB, Complementary Action for Resilience Building activity, implemented in South Sudan by NRC, along with the international organizations that you can see there. We have Access, that's Accelerating Recovery and Resilience in South Sudan, implemented by our colleagues at World Vision, along with 2 local organizations there in South Sudan. We have the Pathways to Resilience project, implemented by Catholic Relief Services, along with an international technical partner. And then finally, we have this is unfortunately one that did not make an easy acronym, but the Building Pathways Out of Poverty for Ultra-Poor IDPs and Vulnerable Host Communities in Baidoa, which is shortened to UPG Baidoa, implemented by, again, World Vision, along with acted there. So that one was in Somalia. There's more information about all of these activities, obviously, in the study itself, but just in terms of an introduction, those are the activities that were the pilots from BHA. And they were started through a pilot APS. So Nepal's and all 3 of the ones in South Sudan came through piloted APS and through a competitive process there. And then in Somalia, that came through a slightly different mechanism, but along a similar logic and similar process there. So that's the organizations involved and the activities involved. So the methodology for the study is quite straightforward. We started with a desk review, which was conducted by our friends at Causal Design. The desk review looked at all of the research that they could find about multi-year humanitarian interventions. It wasn't looking at development interventions. It wasn't limited strictly to USAID or BHA-funded mechanisms. This was any multi-year interventions that they could find, multi-year humanitarian interventions that they could find. And their findings are focused on best practices and promising practices. So again, they're not looking at effectiveness. They're not measuring cost effectiveness or efficiency. They were also looking for promising practices. And that desk review was used alongside discussions with experts from the activities themselves. So the discussions with experts, they really comprise the core of the findings in the studies. We've got, we heard from experts from all of the activities listed on the previous page, along with key experts from BHA that were there during the design phase, all the way through implementation and closeout. So the real core of the research comes from qualitative discussions with experts who are involved throughout, both from BHA's side and from implementing partners' side. Again, there's more detail about the methodology in the study itself, but for today, it's important to know the core came from the perspectives of people who are implementing the programming themselves. And those findings were validated by the findings from the desk review. And then finally, after we drafted the initial report, we held a validation workshop, again, an opportunity for the organizations who implemented these programs along with BHA to come together and ensure that the findings were in line with their experiences and representing their expertise. Pretty straightforward design, and the report is meant to be short, concise, and full of concrete examples that'll help guide programming in the future. Next slide, please. Okay, so without any further ado, we're going to dig right into the findings today. Again, like I said, the findings both today in the discussion and in the study itself, they're separated by phases. The three phases that naturally came up during the scoping interview process were, distinct. There's a design phase, kind of when the ideas are being cemented and the programs are being planned. There's an implementation phase, which is long. It occurs over multiple years. And then finally, the findings related to the exit strategies and wrap up, again, were quite logically separated from the others. And there's overlap and cross-cutting themes throughout. But we'll start with the design because that's where we begin. And one of the key things was just from right at the beginning is to plan for crises. In the areas that are selected for multi-year humanitarian activities, there are going to be shocks that will require adaptation to your plans and flexibility in your responses. So flexibility is absolutely key. Ensure that the flexibility goes beyond the capability to delay something or to shift it. You're really going to want to build in the ability to switch to different modalities, to change across the HDP nexus, and really plan as much flexibility as possible. And then the last point to remember just from at the planning phase is to really solidify partnerships in your planning for shocks. We'll learn more about it when we hear examples from our partners in just a minute here, but it's really important, and there's examples also in the study of when there were agreements made, tentative agreements to support each other in a shock, But when the shock actually occurs, organizations' priorities change, and resources are going to be very stretched and limited. So ensure that in your plans, there's actual documentation supporting them, bringing the other actors into the consortium or signing them up with an MOU is going to be really important. And so, yeah, plan for crises. All of the piloted multi-year emergency activities encountered a fairly major shock within the first 6 months of implementation. So that's very much still in the scale-up phase when resources are already stretched or still coming on board. So it's a very important learning that wanted to be highlighted. Another key finding in the design phase is the importance of co-creation. The co-creation process, it was something that was conducted by the consortium leads. This occurred after the initial proposals were submitted and selected through a competitive process. Then BHA, along with USAID field colleagues and the consortium partners, alongside other BHA-funded actors, we're looking at organizations like WFP and FAO, and even in some cases, UNICEF and others. They all get together for an organized process over a couple weeks to further refine the plans and the consortiums and the activities themselves. This co-creation process was extremely valuable. It was highlighted by all of the organizations as absolutely crucial to their success. It's something that needs to be continued and supported and really emphasized. And again, more information about this in the study itself. Now, Seth is joining us here from the Access Project. Again, that's World Vision, South Sudan. Seth, if you can come off of mute, I'm going to ask you a couple questions that are related to this, and we can talk in a bit more detail using our examples. So Seth was there way back in 2020 when World Vision was kind of creating and designing the Access Project. And Seth, can you tell us a little bit about something that made the design of Access so successful?
Thank you, Bjorn. Access was actually we took into consideration the humanitarian building aspects. We had our goal to actually accelerate recovery and booster resilience. And this was done on the complementary services which leveraged existing programs from WFP, FAO, UNICEF, and other USAID assisted programs. We did target about 25,000 households with about 151 individuals across 4 counties. And the interventions included food security, livelihoods, protection and gender-based violence, mental health, and psychosocial support. We also included disaster risk reduction, then water and sanitation. The design was in collaboration with 2 local NGOs. This included Nile Hope and then the Humanitarian and Development Consortium, HDC. At the end of the project in February, we had reached a total of 237,000 individuals, including 27,000 IDPs. Our final evaluation demonstrated the success of this type of design. We had food consumption score, which increased from 9.0 at baseline to 29.6 at endline. Households involved in group loan savings activities increased from 12.6% to 37% at N-line. Additionally, the proportion of beneficiaries in union who earn cash increased from 29.8 to 54.9%. The proportion of households that reported improved capacity to respond to and to recover from shocks increased from 6.2% at baseline to 25.9% at N-line. And these achievements or successes would not have been successful without the active engagement of local actors. Because of the South Sudan context, we did engage the two local NGOs and community structures as a key strategy. Because of the multi-sectorial nature, the local organizations and the structures were able to select areas where they will be able to add value to the project based on their specific technical areas and the tasks which were available. The local structures were either newly created by the project or they were existing and had to be reactivated and trained. Some of these local structures were government-led. Others were community development committees. Some were disaster risk reduction committees, complaints help desks, child protection committees, and then peace committees. Specifically, some of these local actors took the lead in the peace building initiative because it was central. Without peace, we could not implement other activities. And the identified roles that they did covered the sectors that I mentioned. The local partners really helped identify needs, develop plans, and implemented them, monitored and reported on them as relevant. And this made the project very proactive in dealing with all the situations that we needed to address to make implementation also very successful. Thank you.
Thank you, Seth. Do you mind if I ask just one quick follow-up question? Why did World Vision choose to, or World Vision South Sudan choose to implement the project with local partner organizations instead of international partners who might have had more capacity across those wide variety of modalities and sectors?
Yeah, thank you. That's a good question. The issue is the fragile context of South Sudan. You wouldn't have any organizations which know the context best than the local actors and the local NGOs. So getting them to take the lead on these activities meant that they went out there in very familiar environments, social, cultural, economic, whatever you can think of. And this type of strength meant that World Vision was not going in blind. We were going in partnership with people who knew the ground. And that made us very comfortable, avoided issues which we needed to avoid, and also build on issues that we needed to build on and take them on as opportunities to enhance the effectiveness of project implementation. Thank you.
Thanks very much, Seth. We'll certainly come back to a lot of those points as we go through the rest of the discussion today. Next slide, please. Thank you. So thanks again to Seth. We're going to keep cranking through these key findings in the design phase, and we'll hear from Seth a little bit later on again. That was, I think, there are a couple of very valid points in his little introduction there. One was the importance of local guidance throughout. That's held up strongly from the other actors as well. Really having community engagement and community-centered approaches, but also in the consortium design itself. it's clear that local organizations, the importance of local organizations and the success of local organizations in key roles, whether that's liaising with government actors or specific to the consortium itself, that is really key. And again, we'll touch on that point again later. The next finding in the design phase is organizations talked about the need to plan space for assessments. It's in the design phase, even though the assessments themselves will occur during the implementation phase, because the key learning, the promising bit that they wanted to take away is that the assessments are going to take time and resources during the implementation phase. These multi-year humanitarian activities and the modalities and the techniques that are used are really different. So even organizations with strong, extended histories in specific geographic areas, they're not going to have the ability and the knowledge available to them in order to begin implementation without some additional data collection. So prior experience and prior history in the area, prior connections with the community via humanitarian or traditional development programs, that wasn't seen as enough. What the organizations really wanted is the space and resources to engage the community with assessments that are really focused on their multi-year activities and different modalities that are related to that. So we've got, when organizations are designing their multi-year humanitarian activities, be sure to leave space for that community engagement and those assessments at the start, keeping in mind that this is a complex context likely to have another shock during that same time frame. So front-loading the resources is going to be really important. And finally, the last key finding that we've got here in the design phase is to make the most of a multi-year design. Ensure continuity in the activities that you're conducting. Some of the multi-year humanitarian activities were focused on graduation style design, where they were trying to move individual participants and households through a graduation approach. Over the 3 years, others were kind of more responding to the context and interacting across the HDP nexus, depending on what was required at the time. But the importance, regardless of that type of design, is that the thresholds have to be flexible. There has to be flexibility between the years and across the modalities and sectors. And there has to be ability to plan for delays and have the flexibility to respond to that. So you'll hear me use the word flexibility and adaptability quite a bit today, but it's so strongly tied to success based on the examples that we found in the research. Next slide, please. So this brings us to the key findings from the implementation phase. We've touched on the first one already a little bit, and again, it came up in the discussions around the implementation phase, and that is the use of a crisis modifier. So all of the multi-year humanitarian activities that were piloted used the crisis modifier mechanism at least twice during their implementation, sometimes as many as 4 times, and it's in it's obviously something that's hugely important. So, planning for how to make that as successful as possible is key. The crisis modifier process, as outlined between the implementing partners and BHA, is really straightforward and was seen as a success. The basic idea is that you identify the vulnerable populations and the need, you make a plan for how you can respond to those immediate life savings needs, and you request the approval. When we talked to BHA, they literally said the approval request could be in the form of a 1 or 2 page document that highlights the needs and the response plan. Organizations talked about having like a very miniature proposal that they submitted for the response. And agreement was clear across the board that BHA was super responsive and had very, very quick turnaround for the approval for these crisis modifier responses when they were required. But there were still some delays. Most often the delays were caused by the cluster mechanism, where they had to coordinate their responses with other organizations. And so one of the findings is to really try to pre-plan your engagement with the clusters, clarify what you can do and what you can cover and what you'll be looking to do in case of a shock, and coordinate with other organizations. As we mentioned during the design phase, this needs to be documented coordination. There need to be clear MOUs to make sure that everyone is responsible. And finally, the 10%, which is what is in the agreements for this specific crisis modifier mechanism. It's 10% of the budget. It's significant, and it can be extremely valuable and can cover the needs in small to medium-sized shocks. But the crisis modifier mechanism isn't meant to respond to a large-scale humanitarian crisis all by itself. You'll need to coordinate with other actors. You'll need to be clear with the cluster and other partners about what your limitations are and what your reach is going to be. So again, based on the limitations of the crisis modifier, you can't rely only on other actors. You may have to find other resources within your organization or other humanitarian actors outside that you can document a response plan together, ideally prior to the shock. Okay, next slide. Speaking of the crisis modifier, Wilfred, if you could be so kind as to come off of mute. Wilfred was the project team leader. It's with the P2R project with CRS. That role could be considered like a deputy chief of party for programs. Wilfred was with P2R for a long time. And Wilfred, can you give us an example from the Pathways to Resilience activity where you had to respond to a changing context? Thank you.
Thank you, Bob. Over the course of P2R implementation, we had to use the crisis modifier 3 times to respond to sudden shocks that impacted our areas of operation. I can give you a good example from our Akobo, where we're implementing some of these livelihood activities under P2R. There was a sudden influx of refugees from Sudan and in Ethiopia because of the crisis ongoing in those parts of the world. Those refugees who returned to Akobo required immediate life-saving assistance. Otherwise, they would have relied on the resources, Miaga resources within the communities that we were serving. So having this influx of refugees would have undone the progress of P2R with regards to livelihoods interventions in Akobo. So having this situation, we did a rapid needs assessment with the local authorities and come up with a mini proposal to BHA outlining the immediate needs of those returnees. And with concurrence from BHA, we're able to support the returnees with their immediate life-saving needs, enabling them to seamlessly integrate with the host communities. Thank you.
Thank you, Wilfred. Had you been able to plan in advance a response to this crisis?
Sure. We knew that there would be a likelihood of a crisis, but we did not know when and where that crisis would occur. Therefore, this program design included a crisis modifier, which allowed us to respond to the actual crisis when it came. So the design gave us that flexibility and the ability to respond immediately to these crises. Thank you.
Okay, just one last question for you. So you had the flexibility, you were able to do the mini proposal, the quick assessment, the mini proposal, the BHA, and what was the result there? What happened in this specific example?
Yeah, I think you were able to secure the concurrence from BHA as quickly as possible, and maybe within a week or so, we're able to respond to the needs of the returnees and responded to that crisis. Thank you.
And just to be clear, how did that impact your ongoing livelihood, your longer term resilience building activities that you were doing in the same community?
The modifier allowed us to continue with our livelihood activities with the host communities, and that allowed smooth continuation of the project. At the same time, taking care of the needs of the affected returnees. Thank you.
Perfect, Wilfred. Thanks so much again. And again, we'll hear a bit more from you later. So thank you.
No problem. Thank you.
Cheers. All right, next slide. Yeah, I think that's a perfect example of the crisis modifier. As I understand, CRS was able to respond to the life-saving needs for the returnees that came back to their community, which of course has an important, reason of existence right there. But at the same time, they were able to continue their long-term livelihoods program because the host community wasn't responsible for those life-saving needs. The host community was also supported in their long-term resilience building activity as well. So that's kind of an ideal scenario. And again, you can read more about similar responses in the study itself. Just a reminder here, again, taking a little bit of a breather as we're about halfway through our session. It's a great time to pop any questions that you might be thinking of into the questions and answer mechanism. If you've got a quick one that you want addressed right away, maybe drop it in the chat. That's great, and we'll keep going. So you've heard me talk a lot already today about the importance of flexibility and adaptability, but we're gonna come right back to that again. The desk review also supported this and validated the finding from the research, from the key informant interviews themselves. At every point across every one of these activities, the flexibility led to successful components of the project. The way that it was stated in the desk review is that multi-year humanitarian activities work best when flexibility and adaptability are prioritized at all stages, including planning, financial arrangements, and assessments. And to further enhance that flexibility, implementing partners should use adaptive management strategies that involve regular times to review, pause, reflect, and effectively mitigate the response challenges as they arrive. So because the multi-year activities are taking place over a longer period of time, there's more changes that they have to respond to, but there's more opportunities to be flexible as well. And just the way that the agreements existed, there just are many more opportunities to be flexible and to keep that open communication and adjustment process going. And finally, the flexibility shouldn't be limited. It can be across modalities, sectors, and across any component of the HDP nexus as well. Thank you. Next slide, please. All right, this is our last slide on findings related to the implementation phase. We've got, again, a reminder that locally driven components of your multi-year emergency interventions have greater impact and longer term result. So again, during the design phase, we talked about the importance of community engagement and centering, community priorities, but we'll bring it up again now in the implementation phase and throughout the project on a regular basis through pause and reflect sessions. It's highly recommended for these multi-year activities that you build in those structures of regular assessment and check-ins and opportunities for adjustments and flexibility moving forward. The local, when we talk about being locally driven, for sure this can be in the form of engaging local NGOs whether that's as part of your consortium or just as community stakeholders that are involved. But it's not limited to local NGOs. It can also be local government. We'll hear from Bakari in a minute. It can be local, private companies that can provide services in a sustainable manner. And it can be through informal relationships. There's a strong example in the study where, security was really improved by strong local connections as well, and access was maintained that way. So lots of importance around keeping these multi-year interventions as locally driven and locally centered as possible. And we'll move on to the next slide, please. Okay, so we've got our last section of the last phase, of the findings, and that's related to exit strategies. And we go into this in a considerable level of more detail in the study itself, but the basic findings are quite simple and straightforward, and that is an organization that's implementing a multi-year activity needs to start with the end in mind. That can be incredibly difficult looking at activities over multiple years, especially with those that are on the humanitarian side of the HDP nexus. But trying to maintain sustainability in the design, trying to think about what can exist after the end of the activity and the funding that's associated, is really a successful point that should be continued. It's a promising practice that needs to be considered in future multi-year interventions. Again, it's important to have an exit strategy, to document it clearly, and to update that exit strategy regularly. And then the final point is that exits are going to take longer than you think. There's a couple examples in the study where the implementing partners of multi-year humanitarian interventions were hoping to hand off to another type of funding mechanism. So hand off some of their successful programming modalities to another type of funding mechanism, whether that's working with a development actor or trying to extend some type of humanitarian or development activity afterwards. Especially with development actors, these agreements and processes can take multiple years. So you may be looking at starting your exit strategy for certain activities or a portion of your activities in year one, even though you've really only just begun the activities implementation itself. It's going to take a lot longer than you think. And we'll talk now, Sriju from Mercy Corps Nepal. Sriju, if you can come off of mute. You guys had a fantastic option, an example about how Bakari was able to continue to have an impact now that it's closed. Could you tell us a little bit about that?
Yeah, sure. Thank you, Bjorn, and namaste, everyone. So talking about our exit strategy, having a clear picture from the very starting is very important. So I still recall our initial conversations or discussions with BHA, and from the very beginning, they were very clear that Bakari would not have any extensions or not even a follow-on activity. So this was factored into the design of the intervention, and this was clear for us at Mercy Corps, but we also explained this to our local actors, local stakeholders, including local government and local partners, so that the expectations were clear from the very start. So what or how that clarity changed, what we did is, with that in mind, we went through these CLA sessions and processes. We used to have these quarterly and semi-annual review and reflection CLA sessions, where we worked with partners and talk about it with them as well. And that's how the sustainability was started from the initial CLA process itself. We identified that we needed to work with the local partners and think about the sustainability. And that's where one of our private partners, the ARIA technology, came into the picture, right? It wasn't, they were not partners in our initial proposal, but then we decided to partner with ARIA to ensure that while the immediate requirements of this Bakari program were met, we could also do so in so many ways, and they would so that they would also expand, and that the company, the ARIA Technologies, they could continue and also remain partner with MC, but not only limited to Mercy Corps, but also with the other actors.
So great, thank you. I think that's a perfect example. With this ARIA technology, what did they actually provide?
So they are actually the local, Nepal-based technical service providers, and they deploy a system that uses the electronic vouchers, we call it value vouchers, to distribute food security interventions. And they developed an app, an application, which was more like like entire project management tool that included the project assessments, the deployment itself, and also it has features of monitoring later at the later stage. So it was like a whole package. They developed that, and they also developed a value vouchers card, which the participant received, a digital card with a QR code. And with that code, with that card, the participants were able to purchase food and other necessary materials that they need.
Okay, super cool. So you partnered with a local technology company. You've
Right.
developed this, project management around like a voucher or value voucher modality. How did that become, something sustainable that Bakari, continues even after Bakari closes?
Yeah, so in the context of Nepal, where we operated or we implemented Bakari, it was like very remote areas up in the mountains, right? And the internet connection and the network was very poor. It still is very poor in these areas. So the ARIA technologies and the app they used, it improved over the time. So it has to be, they made that app to be used offline as well. So the offline feature was very important in the context where we worked. And in each house or in each households, they were able to also decide about the quantities of the items, and even the community mobilizers, they provided an opportunity to check with the households. And if they have any specific issues, not even with the materials that they will purchase, or the items that they will purchase, but also including it included issues around gender and paying attention to additional needs. So for example, if a household has people with disability, or the household head is very old and she or he cannot come to the vendor and collect the goods, then the social mobilizers, they take note of that, and we would make sure that the items were provided to their households. So the vendor, when the data is synced to the mobile, they'll also be able to stock what is actually needed by the participants. What that resulted was, it resulted in reducing the waste. So there's not a very big stockpile in the vendor side as well. And as Mercy Corps, we knew that they didn't want, we didn't want to end this process to end with Bakari. So we worked very closely with the provider, and so that they also face the issue in the field. And we worked to promote them, the technology, so that the provider, they could also showcase what they could do in other platforms, like we had the CCG gas coordination groups and in other platforms. So that's how they were also able to promote their business, and it could be used beyond the end of Bakari.
Yeah, and that's a really great example again. And now that Bakari is over, what's happened?
So I think, we had a couple of exit strategies even planned from the very beginning. Talking about these technologies, the service providers, the ARIA, they still remain our partner, Mercy Corps partner. but the system is owned by themselves, right? The area technologies, and they're running the system and providing assistance to not only Mercy Corps, but also to other organizations. And we want to maintain a cost-effective digital system that can be used not only for the small emergencies, but also in the large emergencies if that happens in the future. And also in these kind of large-scale disaster, the system can be used to provide a larger, at the larger scale. So it's customized, it can be customized in that way. And it will also be utilized through the START program, because we have these small local START fundings for the emergency activities. And they are using, the program itself, they are using this app by 20 different local organizations. And they can support the system now, and it can be easily used and accessed by the local implementing partners as well. And it's not only that, the system is being promoted, as I said earlier, by the company, and it's continued. For example, even they have reached their reach beyond Mercy Corps now. Oxfam and Islamic Relief and other organizations are also using it, and it's being promoted by other organizations as well. That's on the private technology side. But talking about the exit strategy, we also had like different activities planned. So for example, we had this approach called Place approach, where Mercy Corps had different layers of handovers planned after Bakari, right? So the knowledge and systems were handed at different levels. We had commitment, even received commitment from the local government, that they will be proactive to these small scale local emergencies, and they can themselves respond to these small scales, because oftentimes, they have tendency to ask international NGOs, even if they're able to do that, respond to these emergencies themselves. So by signing the place, we have their commitment that they can take this forward. And additionally, we also conducted a joint handover meeting with another USAID program, which was implementing in the same area, and we handed over all the detailed documents, relevant documents, so that the USAID project could continue whatever Bakari could not after it ended, and all the efforts will continue without the West.
Wow, thank you. I still think that's such a fantastic example, because you touch on, you started with it from the beginning. Mercy Corps started with this idea to hand over the technology from the very beginning. You engaged local actors, you've engaged the government, it just kind of ticks all the boxes. So thank you again for staying up late in your evening to join us. And again, we'll hear from you a little bit more. We're gonna jump right down to the cross-cutting themes now. These are the big themes that we hit them in every phase from every actor. And we still want to ensure that we leave plenty of time for questions and answers, so keep those coming. And I'm going to ask Seth to come back off of mute to talk a little bit about another specific example from the Access activity. So that, again, World Vision South Sudan. Seth, can you tell us a little bit about just a quick example about how Access kind of engaged across the HDP nexus, and what's something you think that other projects should take away that should be continued in similar projects in the future?
Yeah, thank you, Bjorn. I will pick the second part of your question first, and in answering that second part, bring out the integration of HDP into the Access implementation. So there are three things that I will recommend that we continue in future projects. The first is the locally led peace building. Second is the use of the community structures in project participant selection and other activity implementation. And then our rapid response activities, or the crisis modifiers. Looking at the peace building aspect. Local actors brought together communities in peace conferences, sporting activities, and other youth activities such as drama, and mobilize the communities to discuss peaceful coexistence and social cohesion. The South Sudan context is very fragile. You don't have or education, and these youth mainly depend on farming, cattle, and fishing. And intercommunal violence is very rife. And then there are revenge killings and other things. And the local partners who led these peace building initiatives use the events to get communities to sign peace agreements. And of value is how these local actors even extended invitations to the South Sudanese diaspora to join them in these peace conferences. These were in-person conferences, and they included some of these diaspora organizations and government officials, and these were facilitated by, facilitated by World Vision, but everything mostly was done by these local structures. And in one of those conferences last year, March, in Nassau County, it brought together about 20,000 people physically participating in these activities that were meant to foster peaceful coexistence. The community development structures, we particularly use the community development committees at the forefront of participant selection and also in the implementation of various interventions. Their leadership helped to address a lot of misconceptions and also complaints. The development activities covered market infrastructure, was support to income generation activities, gender-based violence prevention, village savings and loans, formation and training, and then vocational skills training. For example, the CDCs help in selecting at-risk youth, mothers, former child soldiers for this vocational training. About 400 of them of such youths were trained and provided with startup kits to start their own small businesses and keep these people, especially the youth, from negative sort of activities to help also build their resilience. Another crucial aspect that I mentioned is the IRA, which is the crisis modifier. World Vision had originally planned for 3 of such responses, which were to cover the 3 years of the grants. But in the last year, we had opportunity to implement a 4th RRA, or crisis modifier, which was as a result of some savings we had done with the approval of the donor. And it enabled us to respond to the influx of people from neighboring countries as a result of conflicts. So such strong HDP programming, as demonstrated, also was facilitated by a strong adaptive management, which meant that we kept in touch with the context and adapted our approaches and everything that we were doing to situations which came up, whether predictable or unpredictable. And in addressing some of these challenges through the HDP, we were able to actually get projects to be effective in implementing and also be effective in using the resources that addressed all the multi-challenges in the context for a sustainable outcomes by the project. Thank you, Bjorn.
Thank you again, Seth. Absolutely, really appreciate it. And they're great examples of working across the HDP nexus. So thank you for that. It's so much better to hear from those of you who had experiences directly implementing this. And being as we want to save time for Q&A, and I don't have anyone to help give demonstration of examples again for localization, I think we can rely on the examples that we've heard about through the different phases already. And we'll just recognize that, being locally driven, locally led, working with local partners really can't be emphasized for the importance of how tied that was to success and to the promising practices. But you've heard enough from me today, so we'll jump down to the next slide. And I want to bring Sriju from Mercy Corps back on the line here one last time to talk to us about, the cross-cutting theme from the study is called, gender and youth priorities. That was super clear, and Mercy Corps has a great example of this, and they call it the Jesse approach. So what is the Jesse first approach, Sriju, and could you give us a bit of an example on it?
Sure. Yeah, so talking about the Jesse first approach, in Nepal, it's not just gender or youth, but it's also about the social inclusion. So gender equality and social inclusion, because social inclusion is also a key issue here in Nepal. So the Jesse first approach is including not only gender, but also including the socially excluded groups, be it the caste, ethnic, different caste, ethnic minorities group, into the heart of the activity from the design phase itself. So usually in our communities, the community leadership in these groups and committees are usually headed by the males, and even males and from the upper caste. So we had this Jesse first approach, which means that no one in the community that we worked are left behind. So that was the Jesse first approach.
Thanks. Can you just tell us a little bit about how that influenced Bakari, how being driven by a Jesse first approach, what did that look like in Bakari?
Sure. Yeah. So the Jesse first approach that was thought from the very starting process. I still remember when we were developing the full proposal for Bakari, and during the co-creation phase itself, we worked on how to make this Jesse first approach implement effectively in Bakari. So we included gender and Jesse, even when designing our organogram for this Bakari project, we included a director position, which will have a say in the SMT, right? A dedicated, focused Jesse director in the SMT, so that the focus was central to the activity. And it was not only Jesse director. We also ensured that the Jesse focused staff were in the local partner organizations as well, the partner organizations that we worked with. So all the ground level staff up to the SMT level, the Jesse was represented and also spoke about very prominently, and that resulted in a very robust targeting approach, not only at the staffing level, but also when we're selecting communities, when we're selecting participant, because we use the weighted vulnerability criteria. And we were seeing the targeting not only from the male or female perspective only, but we were also looking at other intersectionality. So for example, looking at the disability and other vulnerability factors. And we did this in consultation with the community so that there was no conflicts, later. And there were specific Jesse-specific models or approaches in the project itself. For example, we used to have these household dialogues, where the household members sit together and discuss about the division of the labor within the household. And these kind of stand-alone activities definitely resulted in the better outcomes. But the other thing is, in addition to these stand-alone activities, the Jesse activities were also integrated in each of the themes, like the livelihood, agriculture theme, in the water security, and in the DRR. So it was Jesse was integrated all over the program. So that was how this Jesse first approach was initially thought about, and then it definitely it had very effective outcomes.
Yeah, and I think that's it. It just like you said, it strengthened the outcomes for Bakari, having that
Right.
Jesse first approach. But it also, this is something that occurred across the other actors as well. And again, there's more about this in the study. Finally, this is our last cost-cutting theme. We found kind of surprisingly that climate came up across the board as a cross-cutting issue. Wilfred, do you have time for just a one quick question back and forth? Could you give us an example about how CRS's Pathways to Resilient project felt the need to include a climate component?
Sure. Pitwara was a multi-sector project, and from the DRR component, there was a demand by the communities to adapt to the effects of climate change. Therefore, with regards to that, Pitwara worked with the communities to ensure that they implemented climate smart agriculture to adapt. The communities are aware that if they are not going to adapt sooner, they might be hit very hard by the effects of climate change. So that's one example where we work with these communities to adapt to the effects of climate change. Thank you.
Yeah, and that's, again, it's super clear. Great example, Wilfred. Thank you. The communities know this. They understand that the change is occurring and adaptation is going to be key. So I think that is a fantastic example to end on. We've got about 15 minutes left for Q&A. Thanks so many of you for putting your questions in. I've responded to a couple just on the side in the chat as we've been going. If you haven't put a question in, but you think one is really important, you have the option of clicking that little thumbs up button, and you can prioritize your friend and colleagues' questions to make sure that they rise to the top and make sure that we have a chance to address them. Again, giant thanks to everybody who contributed to the study. There's some of you on the call today that didn't have a chance to speak because these multi-year interventions are wrapping up or in their final wrap-up stages. Some of the people who contributed to the study have moved on to other activities, so huge thanks to them as well. And obviously a big thanks to those who are able to make it to the call today and for sharing their wisdom and experiences as well. There's a couple different questions that I want to address, and I want to make sure we have a chance to get the ones that are pointed at our colleagues who are here. I see one specifically directed at Seth. It's from an anonymous participant, so we can't. Seth, are you still there? Are you able to come off of mute? There's a question. There's a question for you that says, does the structure that they created still function today? And if so, what is a critical factor to this? I'm going to go back and try to remember what structure they're referring to. Unfortunately, it's an anonymous. Yeah, go ahead.
Yes, I refer to structures like the community development committees. Yeah,
okay.
Still work. There are also the relevant government departments at the local level, which also continue to work. There are also the project-initiated disaster risk reduction committees, which continue to work because these disasters like floods and those things continue to plague these target communities. We also have peace committees, which also continue to work even after the project has ended. And these are also sort of linked to the local NGOs that we worked with. Those local NGOs are still existing and will continue to keep the relationship that the project established with all these structures. Thank you.
thank you again. I think that was probably what they were looking for. Thanks for your guidance and answering the question as well. Appreciate it. There's a question that I think is quite brief. Another one from an anonymous participant saying they're involved now in a co-creation activity, and the lead organization has pretty much dictated what the partners should design. Is this normal? Yeah, maybe, but is that a best practice? I would say probably not. You know, in co-creation, we want to have a focus on what what the study is saying. The findings are clear. You want to have local organizations and local community perspectives really guiding the design, not a top-down approach. In fact, quite the opposite. If we had to have a clear answer there. Unfortunately, if they hold the decision-making cards, I'm not sure you'll have a lot of options, but do your best and good luck. And then there's another question for Wilfred. Wilfred, if you're still available for to answer a question. Wilfred, are you with?
Yes, I am available.
Brilliant. There's a question for you from Mary Dean. They ask, when time came for redefining the target population, did you add in returning refugees to your evaluation reporting? Yeah, I guess that's the question.
Yes, we did. Because we also wanted to have a better understanding of how the rapid response activity impacted the overall outcomes of the P2R. So that's what I can say about including the returnees in our final evaluation as well. Over.
Okay, perfect. Thanks, Wilfred, and thanks again for the questions. I'm going to put a last call in for questions now. I think we've addressed either bilaterally on the side, or we've directly answered the questions that have been brought up. So we can move towards closing out the conversation today. Kind of a last call for questions. Get them in the chat, get them in quick. And otherwise, yeah, we've got another event. It's the next and final event in the HDP Coherence in Practice series. This is insights from the implementing community on operationalizing HDP Coherence. Jenny, did you want to come on and say something about that quick?
Sure. And before I do, I just want to thank you, Bjorn, for moderating the discussion today, and also for being a huge part of bringing about this study. I want to thank Wilfred and Shriju and Seth for being available to speak today. I know that you were mentioning that most of these activities are closed out or closing out, so to come back and speak about this is commendable. We really appreciate that. The community can't learn without hearing from your experience, so that's really important. Thank you for your contributions. And to the participants here and those who are asking questions, thank you also for coming today. I mean, I think it's also really important to have a community that's interested in learning and participating in this discussion, and maybe also putting some of these promising practices into action so that we can continue to learn how to better do these type of how to better do HDP coherent work in the field. All right, so I'm in terms of this next series here, IDEAL is working on some practice notes that really go deep into HDP coherent practices for specific contexts and activities. So this last and final event in our series is going to pull out some of those cases and really elevate them, share them with the community, and discuss some of those practices that came out of those. So please register for that event so that we can have a very interesting discussion about those practice notes. Before you log off today, I hope everybody hasn't run away. Before you log off today, we really would love to hear from you. So Bella's going to put a link to a survey in the chat. Please fill out that chat. We take these seriously. We use your feedback to create events that are tailored to your preferences. So give us your thoughts. Let us know how today landed with you. Make sure to check out the full report. So Bella has also put into the chat the link to the report. Definitely download that. Get more into depth as to what you heard today, and share with your colleagues as well. And look out for an email from us. So we will also be sharing these links out in an email once the recording for this is finalized and uploaded. And you can share that email with your colleagues as well, so that those who were not able to join us today can also go back and view this webinar. So thank you so much for your active involvement. And again, Bjorn, thank you for moderating. I'm going to say goodbye for now. Everybody enjoy your day or your evening, wherever you are, and see you next time.